approximately 30 million patients apparently I've heard, I'm not so sure it's really true, but wearing dentures. That's in America. That's a lot. That's 10%. Didn't know so many of us are so old already, but anyway. Dentures, most of us, at least, in my age, your age, if we think of dentures, we know grandma. And we see those things in the nightstand, in the water, and we see a very caved in, dried out, kind of like a tomato face, ugly. Now, it's not anymore like that, and there's quite some advancements. But in any case, most people have denture problems every few years, and they keep thinking that denture's getting loose when it is really that their gums, their bones are shrinking. It's like, it's not that my bands are getting tighter, it's my tummy which is getting, bigger. Yeah. And so I shouldn't blame the tailor about my pants. They kind of, even though I try to, but, it doesn't work. He just looks at me and says, "What are you, nuts?" So, but there is this new thing these days, and, implant-supported denture. I call them a hybrid. Basically, you put a couple, 2, 3 implants in it. Depends on what it takes. As more the better, obviously, but apparently very few do the trick. You do the denture, and all of a sudden, you seem to have a snug, tiny fit, and it stays there forever. Tell us about it. How much of this is fiction, and how much of this is true?
Oh, you got it. Well, what happens is when the teeth aren't in the bone, there's no stimulation, so the bone will shrink up. So the denture is not, like you said, it's not wearing away. The gums are getting smaller. So every few years you want to readapt the denture, fill it in inside so it fits against the bone or the gums where it's shrunk. But the implant supported is definitely a very nice way to go, especially for the lower arch, because the tongue and the lips always move and cause them to get loose. So there's a lot more problems with the lower dentures than the upper, but either one. Now, what the implant does is it does two things. You get a very strong attachment to the denture because it's basically, usually it's either a bar or a little ball, and it just snaps right onto it, so you get a very good snug fit so they don't move around. But the implant is also into the bone, and what that does is it stimulates the bone, so the bone stays stronger around the implant, so it doesn't shrink up as much. Now, nothing is forever, so instead of every 3 years, but maybe every 6 to 10, you might need to still do a little bit of a readaptation to some of the other areas for the bone loss that may have occurred in some other spots, but you may not notice them getting loose because they're adapted so well to those attachments. Now, as far as the number of implants, a while ago we would do 2, but we find that when you have 2 points, you get a straight line, and then you can get a rock back and forth. So now we go to either 3 or 4 so that we get anti-movement in all different planes, so it doesn't rock back and forth. So 3 to do a tripod, or 4, 2 on each side. Well, we really find that those are awesome as far as how snug they are and how well they work and how long they last.
Beautiful, because one of the things which I think goes with certain, when we need certain prostheses, when we have certain problems, that may be, I need reading glasses, and yeah, there's a certain stigma which goes with it when you put them on and you go, okay, that's it. You can see it by the jokes, getting old is not all it's cracked up to be, and you put your glasses on it and stuff like that. So when a person has a denture, it goes with, I'm old now, and they don't feel so good, especially it looks like when the denture is a little bit wiggle-woggly, then, at a Thanksgiving dinner with people, and even though the denture might never fall out, it feels like it could, and so people become careful. They start laughing like this, and they start chewing carefully, and automatically their mental, they get older mentally. Does the implant-supported denture, is it so good that people will have no doubt anymore? It's like, no, I don't need to worry. I can laugh. I can cry. It's all fine. This will not fall out.
Oh, yeah. Absolutely, Helmut. Basically, they almost have to, pry them off of the attachments to get them out. So they can now eat, bite into apples, and do all of that good stuff.
So they can,
even though they have
really
a denture.
They really can bite into an apple or chew on a spare rib.
Yeah, as long as you get the 3 or 4 implants. If you have 2, you might get a little movement, but if you have the 3 or 4 in there, you can bite into, all your normal foods and take care of that.
Beautiful. What about the tasting? Because I've heard that the denture on the top, they have this plastic or metal which goes over your palate, which is part of a suction to help it staying there, and thus you lose your taste spot, because really we taste our food much more with the gum, the palate up there, than with the tongue, and when you have implant-supported denture, is this wall over your palate still needed, or can you now taste food better also?
Well, that's a good point. And part of the tasting is the taste buds that are all over in your mouth, and the other part is just that feeling of plastic there gives you that taste of plastic anyway, so the food doesn't taste as nice. But with the implant supported, you can make just a U shape, so you don't have to cover the whole palate. You just have the ridge covered, and so you get your tongue. You don't speak with a lisp as much because your tongue can do better positioning, and you can taste your food better, and it's more secure. So it's definitely a nice way to go with the implant-supported denture.
Good. And implant-supported denture, never ever any more denture cream or that type of stuff needed?
Right. The attachments to the denture, like I said, it's usually either a ball or a bar that's clipped on, so you don't need the creams in there, which, can taste foul and all that good stuff.
Yeah, I mean, I know, thanks God I never had to have it, but it just couldn't be a good thing. And what do you say about, there have been news lately even that some of that denture cream, Fixodent and stuff had too much zinc in it. I'm sure they're fixing it by now, and it's probably not scientifically 100% proven, but people apparently who overdo it, because the ones who have loose dentures constantly need to put that stuff in it, and they apparently got nerve damages which handicap them physically and mentally. Not proven, but cases seem to be out there. Did you hear about it?
I haven't heard of the cases, but I did. They did contact probably all the dentists, because I got some, letters and emails or whatnot from the company saying, make sure you instruct the patient to only put a couple of dots here and there and not to overdo it. In fact, I had a patient the other day who said he won't use that because it gave him a upset stomach. So there are some issues where you want to, make sure you don't use a lot of that material.
Right. Well, I mean, besides of bad tasting, bad feeling, I mean, any glue couldn't possibly be too healthy. I mean, give me a break. I don't know. I mean,
right.
So the way to avoid it is obviously get an implant-supported denture in the first place. So because never mind the other benefits, which are huge, but you're also avoiding that one, just in case there's some truth to this thing.
Right.
Well, by the way, one more question. If a person has a denture, and it's a normal denture, and he decides to go for an implant-supported denture, can he still use that normal denture, and by doing so save a little bit of money? Because, first of all, these implant-supported dentures are lots cheaper than a whole series of implants, right?
Right. And yeah, you can use your same denture. There's usually a little bit of a time while the implants are getting, the bone actually fuses around it, and then we add the attachment. So during that time, you can wear your denture. And then we can basically retrofit it. We would just hollow out inside the denture where that post is sticking up and add the attachments onto it. So you absolutely can. Now, I do recommend a spare set because you don't want to go without your teeth. So you never know if something happens. You're taking it out to clean it. It drops, it cracks, it chips. And those might take some time to repair, or maybe you're out of town. So having a spare would be a good idea.
So basically, if a person, because obviously dentures have a certain look, right? And maybe the guy got dentures 4 or 5 years ago, and in the meantime he says, Doc, I'd like them a little longer, a little wider, a little smaller, whatever it is, right? Maybe the color a little different, so you make him a new set, but maybe you use the old set as his spare one.
Yeah, we do. That's typically how it's done. Most patients want to do a little bit of improvement, maybe make them whiter, maybe something had chipped somewhere, so they at least have a spare, and we make them a new set.
Beautiful. And what about bone shrinking once you have those implants supported? Is that going to be slowed down, halted very much? Because we don't want the bones to keep shrinking either way, right?
Right. Directly around the implant, the bone will not shrink because it's stimulated. And even, maybe up to a half an inch around the implants, we get that stimulation effect stays in that area. Something farther away may still shrink up a little bit, but it's a lot less than if you don't have any implants.
Beautiful.
For sure.
Beautiful. Absolutely wonderful. Thank you very much. Very interesting. Bye, Dr. Auerbach.
Bye, Helmut.